Good evening, everyone. We are so happy to welcome you all to the Egypt launch webinar of the 2020 Lancet Countdown Report on Climate Change and Health, hosted by Newgiza University School of Medicine. I'm Inji Swalam, and I will be your moderator for tonight. Health and climate change have proven to be directly connected to the very difficult times we are living. Pollution has impacted the quality of the food we eat and the air we breathe, creating increased risk on the health and well-being of the people of this planet. 120 world-leading experts from 38 academic institutions and UN agencies from every continent have looked at more than 40 indicators for the 2020 report of the Lancet Countdown on Health and Climate Change. Tonight's webinar will contextualize the findings of the 2020 Lancet Countdown Report and will be bringing together leading academics and policymakers with wide-ranging experience. Our webinar will take place from 6 p.m. till 8 p.m. Cairo time with two panels. Today's speakers are Professor Dr. Sameh Farid, Newgiza University President and former Minister of Health and Population in Egypt. Professor Dr. Ragab, Newgiza University Vice President for Life and Health Sciences. Dr. Lamiaa Mohsen, Newgiza University Dean of Medicine. Dr. McGushin, expert from the Lancet Countdown Report. Dr. Mawaheb ElAzm, ex-Chief Executive Officer of Egyptian Environmental Affairs Agency in Egypt. Dr. Maha Adawy, Director of Healthier Population at the World Health Organization, Eastern Mediterranean Regional Office. And last but not least, Ms. Omnia Omrani, Liaison Officer for Public Health Issues at the International Federation of Medical Students Association. And now, we will start off with a keynote speech by Professor Dr. Sameh Farid, our Newgiza University President and former Minister of Health and Population.
I would like to welcome you all here at Newgiza University today, all our participants, speakers, attendees, in launching the 2020 Lancet Countdown Report. And I would like to make a brief presentation about what I think, what I have read, what I have heard, which is, at the end, I thought I should say to you before we start, or at the end, it is good not to know. But eventually, sometimes we think it is better to know as to be prepared for the coming era. As we may know, that we have a big challenge in this climate change issue. One moment. When addressing the climate change issue, its implication to humanity, it is imperative that the quality of air is mentioned. The justification is that the pollutants are principally caused by burning the fossil fuel, and so are some of the greenhouse gases, including the main culprit, that is the carbon dioxide. Any efforts required to minimize the emission of greenhouse gases will improve the quality of air and prevents health hazards. The surface temperature of the planet Earth increased in the previous century at a faster rate than ever before. In the past century alone, the temperature climbed 0.7 degrees Celsius, roughly 10 times faster than the average rate of ice age recovery warming. The reason for the phenomena of the global warming is the increase of some gases in the atmosphere that act like greenhouse and trap the absorbed heat near the surface of Earth. The principle of the greenhouse gases are water vapor, surface ozone, carbon dioxide, methane, fluorocarbons, and nitrous oxide. The effect of the different members of those gases depend on their lifetime in the atmosphere, ability to absorb heat, and volume. By far, the carbon dioxide is considered the greenhouse gas with the maximum effect. It has impact It has impact on especially vulnerable population, leading to millions of environmental refugees. It has impact on human health, which has a medical and physical health, and on the mental health, and at the end, on the community health as well. Impact on forestry, shifts on range species, increased frequency of forest fires, and economic disruptions. Impact on agriculture, shifts in crops, agricultural pests, livestock diseases, shift of demands for irrigation. Impact on hydraulic electric generation through declining water level in reservoirs and other inland water system in some region, possible increase elsewhere. Health effect of major pollutants are the sulfur dioxide, and which causes respiratory irritation, shortness in breath, impaired pulmonary functions, increased susceptibility to infection, illness in the lower respiratory tract, chronic lung disease, and pulmonary fibrosis. Respirable particle matters cause allergy, irritation, altered immune defense, systematic toxicity, decreased pulmonary function, and stress on the heart. Other emission of gas such as nitrous oxide and carbon monoxide, surface ozone, which are mainly generated from activities of air change and hence affect the health. Climate change is a public health issue. It has been linked to chronic conditions such as kidney disease, depression, and chronic obstructive pulmonary disease, and can show the body response to existing and assaults into overdrive. Climate change affects the social and environmental determinants. Clean air, safe drinking water, sufficient food, and secure shelter. Between 2030 and 2050, climate change is expected approximately 25,000 deaths per year from malnutrition, malaria, diarrhea, and heat stress. The direct damage costs to health, excluding costs in health determining sectors such as agriculture and water sanitation, is estimated to be between $2 to $4 billion per year by 2030. Areas with weak health infrastructure, mostly in developing countries, will be the least able to cope without assistance to prepare and respond. Reducing emissions of greenhouse gases through better transport, food and energy use choices can result in improved health, particularly through reduced air pollution. What is the impact of climate change on health? Extreme heat is number one. Extreme heat, high air temperature contribute directly to deaths from cardiovascular and respiratory diseases, particularly among elderly people. In the heat wave of summer 2007, 70,000 people died, and lately in Europe we can see when we never have increase in the temperature above 40 and 45 degrees and 43 degrees. It is an emergency where the Minister of Health and the Prime Minister have to address the people what to do in such conditions. High temperature also raise the level of ozone and other pollutants in the air that exacerbate cardiovascular and respiratory diseases. Pollen and other aerial allergen levels are also higher in extreme heat. This can trigger asthma, which affects around 300 million people. Ongoing temperature increases are expected to aggravate this burden. In Mordechai, research has warmer temperature, which is interesting, increased transmission of vector-borne disease up to an optimum temperature or turnover point above which transmission slows. Just as they carry different diseases, different mosquitoes are adapted to a range of temperature. Climate change will also affect the infectious diseases occurrence. A number of these are well known to be climate sensitive, such as malaria, dengue fever, West Nile virus, cholera, and Lyme disease are expected to worsen as climate change results in higher temperatures and more extreme weather events. Events September 2014 is the reference. Bird flu, cholera, Ebola, plague, and tuberculosis are just few of the diseases likely to spread and get worse as a result of climate change, according to a report released by the Wildlife Conservation Society. Natural disaster may contribute and definitely will contribute in the health issues. Globally, the number of reported weather-related natural disasters has more than tripled since 1960. Every year, these disasters result in over 6,000 deaths, mainly in developing countries. Rising sea level and increasingly extreme weather events will destroy homes, medical facilities, and other essential services. More than half of the world population lives within 60 kilometers of the sea. People may be forced to move, which in turn heighten the risk of a range of health effects, from mental disorders to communicable diseases. Floods and extreme precipitation are also increasing in frequency and intensity. Floods contaminate fresh water supplies, heighten the risk of waterborne diseases, and create breeding grounds for disease-carrying insects such as mosquitoes. They also cause drowning and physical injuries, damage homes, and disrupt the supply of medical and health services. Rising temperature and variable precipitation are likely to decrease the production of staple foods in many of the poorest regions. This will increase the prevalence of malnutrition and undernutrition, which currently causes 3.1 million deaths every year. Increasingly variable rainfall patterns are likely to affect supply of fresh water. A lack of water can compromise hygiene and increase the risk of diarrheal diseases, which kills over 500,000 children aged under 5 years every year. In extreme cases, water scarcity leads to drought and famine. By the late 21st century, climate change is likely to increase the frequency and intensity of drought at regional and global scale. German Watch Institute presented the results of the Global Climate Risk Index in 2020, million deaths every year. During COP25 in Madrid, according to this analysis based on the impacts of extreme weather events and the socioeconomic losses they cause, Japan, the Philippines, and Germany are the most affected places by climate change today. LORN is an acronym for 6 factors that affect climate: latitude, ocean currents, wind and air masses, elevation, relief, and nearness to water. The pattern of infection, climatic conditions strongly affect waterborne disease and disease transmitted through insects, snails, or other cold-blooded animals. Changes in climate are likely to lengthen the transmission season of important vector-borne diseases and to alter their geographic range. For example, climate change is projected to widen significantly the area of China where the snail-borne disease Schistosomus occurs. Malaria is strongly influenced by climate, transmitted by Anopheles mosquitoes. Malaria kills over 400,000 people every year, mainly children under 5 years old in certain African countries. The Aedes mosquito vector of dengue is also highly sensitive to climate conditions, and studies suggest that climate changes are likely to continue to increase exposure to dengue. Measuring the health effects from climate change can only be very approximate. Nevertheless, the WHO assessment taking into account only a subset of possible health impacts and assuming continued economic growth and health progress concluded that climate change is expected to cause approximately 250,000 additional deaths per year between 2030 and 2050. 38,000 due to heat exposure in elderly people, 48,000 due to diarrhea, 60,000 due to malaria, and 95,000 due to childhood undernutrition. All population will be affected by climate changes, but some are more vulnerable than others. People living in small island developing states and other coastal regions, megacities, and mountainous and polar regions are particularly vulnerable. Children, in particular children living in poor countries, are among the most vulnerable to the resulting health risk and will be exposed longer to the health consequences. The health effects are also expected to be more severe for elderly people and people with infirmities or pre-existing medical conditions. Areas with weak health infrastructure, mostly in developing countries, will be the least able to cope without assistance to prepare and respond. The future changes are now visible already in Yemen. Water changes in Yemen, a glimpse of what the future may look like for the entire Middle East and North Africa region, the MENA region. A new World Bank report reveals that if current trends continue as a whole, the region will get hotter and drier. Shorter growing season could threaten food security, and competition for divining natural resources could fuel conflict. A plague of locusts has descended on East Africa. Climate change may be to blame. In order to deal with such risks, funds and organizations were established to raise finance to help vulnerable regions adapt to damage, which have started to occur, and on a more global concept, introduce projects to mitigate further risks by changing conventional fossil fuel energy to renewables. The world succeeded in the Paris Agreement to set out a global framework to avoid dangerous climate change by limiting global warming to well below 2 degrees Celsius and pursuing efforts to limit it to 1.5 above the pre-industrial level also aims to strengthen countries' ability to deal with the problem. In 2015, which is 5 years ago, the WHO Executive Board endorsed a new work plan on climate changes and health. It included partnership to coordinate partner agencies within the UN system, awareness raising to provide disseminate information on the threats to climate changes, science and evidence to coordinate reviews of scientific evidence on the links between climate change and health, support for implementation of the public health response to climate change to assist countries in building capacity to reduce vulnerability to climate change and promote health while reducing carbon emission. Many climate action was produced this year, the last year. Many organizations, United Nations Environmental Assembly, there are reports coming from here and coming from there. And it's about time for this report will tell us what happened and what went right and what went wrong in the last 5 years. But one of the most expressive words written to portray the extravagance in the use of energy said, if every person living in the developing world would have the same carbon footprint as an average person in the US or Canada, we would need the equivalent to 9 planets to absorb the carbon dioxide. Thank you all, and may God save our planet.
Thank you, Dr. Sameh. We do need 9 planets if we continue like this. And now we will have a presentation by Dr. Alice McGushin, our expert from the Lancet Countdown.
Thank you so much for allowing me to speak today, and thank you so much to Dr. Farid for that excellent introduction. Thank you to Newgiza University for hosting this event. I must say that the timing of this event is crucial. While this year has been dominated by the devastating pandemic, we are but a few days from the 5-year anniversary of the adoption of the Paris Agreement that Dr. Farid just mentioned. I was there in the room at the climate change conference in Paris on that fateful day 5 years ago. A few weeks ago, the next annual conference of parties, COP26, was supposed to have taken place in Glasgow. However, this has been delayed to November 2021. But a delay in our meeting cannot mean a delay in our response to the health effects of climate change. And in this year's report, the 2020 report of the Lancet Countdown on Health and Climate Change, Responding to Converging Crises, we focus our message on the joint response to the converging crises of climate change and a COVID-19 pandemic. In the next few minutes, I will describe the key messages of the 2020 Lancet Countdown's report and draw out the headline findings of a small handful of our indicators and explain what they mean for Egypt. So briefly, an introduction to the Lancet Countdown. The Lancet Countdown publishes in The Lancet, one of the oldest medical journals in the world and arguably the most influential. It has worked to better understand the links between health and climate change for 3 decades now. In 2015, there was a Lancet Commission on Health and Climate Change, which concluded the anthropogenic climate change threatens to undermine the last 50 years of gains in public health. However, tackling climate change could be the greatest global health opportunity of the 21st century. Each year since 2015, the Lancet Countdown has published its annual report in the Lancet, which tracks the world as it moves from climate change as a threat to human health to the response to climate change as an opportunity. So in our 2020 report, we draw on the expertise from 38 leading academic and UN institutions from around the world, bringing together over 120 climate scientists and geographers, mathematicians and physicists, transport and policy experts and energy experts, development experts, engineers, economists, social and political scientists, and health professionals. There are several key exciting developments in our 2020 report, and this year we have new indicators tracking heat-related mortality, migration and population displacement, access to urban green space, the health benefits of low-carbon diets, the economic costs of extremes of heat and also labour capacity loss, net carbon pricing, and the extent to which the UN Framework Convention on Climate Change's nationally determined contributions engage with public health. Also, the majority of the existing indicators reported in the 2019 report have been improved, with methods, data sets, and geographical and temporal coverage extended. So we have three key messages of the 2020 report. Our first key message is this. Our 2020 report reveals the most concerning outlook yet, with concerning and often accelerating trends seen for each of the human symptoms of climate change we monitor. And whilst these effects are unequal and disproportionately impacting the most vulnerable populations and those who've contributed the least to the problem, no country, whether rich or poor, is immune to the health impacts of climate change. Our second key message is that the COVID-19 pandemic and climate change represent simultaneous and converging crises. Looking back at 2019, we have seen fingerprints of climate change in disasters happening all around the world. And in 2020, such events have occurred concurrently with the pandemic. While such events have occurred this year, we ask, how does one ensure that social distancing can be ensured when evacuating communities and providing emergency shelter? At the same time, governments around the world are preparing their economic recovery from COVID-19. But if these economic stimulus packages don't align with a response to climate change, for example, if they include investments in fossil fuel projects, we risk failing to meet the target laid out in the Paris Agreement. However, aligning the global recovery from COVID-19 with our response to climate change will improve public health through cleaner air, increased physical activity, and better diets. Investments in a green recovery will see a more stable and sustainable economy. And preventing further climate change will protect our natural environment for the enjoyment of future generations. Immediately before the 5-year anniversary of the adoption of the Paris Agreement, and as countries set their NDCs, the time to act is now. So briefly, I'm going to touch on a few of our key indicators that inform the key messages that I've just mentioned. I'm going to today focus mostly on our indicators of heat, as these are of particular relevance to Egypt. Exposure to extremes of heat results in a range of health consequences, including heat stress and heat stroke, worsening heart disease and acute kidney injury. Populations over the age of 65 are particularly vulnerable to these effects and are being exposed to heat waves in increasing numbers. This first indicator tracks the change in the number of heatwave exposure events, with one exposure event being one heatwave experienced by one person aged over 65, and the days of heatwave exposure in this population, comparing this with a 1986 to 2005 baseline. Looking globally, there were a record 475 million additional heatwave exposures affecting vulnerable populations in 2019, and this was 2.9 billion additional days of heatwave experience compared to that 1986 to 2005 baseline. Considering Egypt, there were over 61 million person days of heatwave exposure in 2019 compared to that baseline period. And looking across 2015 to 2019, all of those years were among the hottest years across the 30-year period we study. A new indicator for this year's report is heat-related mortality. So in this indicator, we apply an exposure response function and optimum temperature data to daily maximum temperature exposure of the population over 65 to estimate the attributable fraction and thus the deaths attributable to heat exposure. From 2000 to 2018, heat-related mortality in people over 65 years has increased by 53.7%. And in 2018, it reached 296,000 deaths, the majority of which occurred in Japan, Eastern China, Northern India and Central Europe. Considering Egypt experienced an estimated 2,720 heat-related deaths in the over 65 population in 2018, and the 2014 to 2018 average was 128% higher than the 2000 to 2004 annual average of 1,130 heat-related deaths. Heat also affects our ability to work, which can have downstream effects on loss of income and livelihood. Another indicator that we track looks at the potential hours of labour lost in agriculture, construction, service and manufacturing sectors. Across the globe in 2019, a potential 302 billion work hours were lost, which is 103 billion hours more than those lost in 2000. Looking at Egypt, the number of potential hours of labour lost in 2019 was 1.35 billion, and the 2015 to 2019 average was 182.4%, or almost 900 million hours higher than the 1990 to 1994 average. Applying national hourly earnings for each sector, taking that last indicator I presented, we can estimate the loss of earnings from the labour capacity loss from the previous indicator. In lower middle income countries, this loss could be as high as 5.9% of annual GDP. Looking at Egypt in 2015, the heat-related reduction in labour capacity loss could have resulted in up to 2 to 4 billion US dollars in earnings, which is around 0.56% of Egypt's total GDP for 2015. Considering our response to the health impacts of heat related to climate change, an important adaptation measure to counteract these effects is the fostering of green spaces in our cities. This measure of exposure to urban green space is another new indicator for the 2020 report and uses remote satellite sensing to estimate the normalized difference vegetation index, which is an indicator of the level of green coverage of the Earth's surface. Considering urban centres of over 1 million, in 2019, only 9% of 468 global urban centres had very high to exceptionally high levels of greenness. Notably, they only included 5 capital cities. Concerningly, 49 of the 468, home to more than 156 million people and including 21 capital cities, were at the opposite end of this spectrum with very low levels of urban green space. Looking at Cairo, Cairo's average level of urban greenness is low, as is the average for Egypt. Looking at our response in terms of mitigation, as mentioned by Dr. Farid, a key way to tackle climate change is to cut greenhouse gas emissions in the energy system. The power generation sector is the largest contributor to global greenhouse gas emissions, and burning fossil fuels contributes to the majority of these, and also to toxic air pollution, as Dr. Farid mentioned. Looking at this indicator, we track the carbon intensity of the energy system, both at the global and regional scales, and this is expressed as the CO2 emitted per terajoule of total primary energy supply. The carbon intensity of the world's energy system has remained pretty much flat for the last 30 years. However, has declined in some places such as North and Western Europe and the USA, and is increased in other places such as China and parts of Asia. At 53.9 tons of carbon dioxide per terajoule in 2017, the carbon intensity of Egypt's energy system is just below the global average of 56 tons of carbon dioxide per terajoule. So a key way to reduce this carbon energy intensity is to switch from fossil fuel sources to renewables. Another indicator tracks the electricity generation and the share of total electricity generation from low carbon sources. Power generation from the renewable sector, in looking at wind and solar, is increasing rapidly. However, the share of wind and solar of total power generation remains low at 6.5% globally. For Egypt, the growth in renewables has been much slower and was 1.2% in 2010 and 1.5% in 2017. Looking over the same time period in China had 1.2% in 2% of renewable share of power generation in 2010. However, this has risen to 6.5% in 2017. So phasing out fossil fuels, as Dr. Farid mentioned, has the additional health benefit of reducing population exposure and premature mortality from air pollution. Air pollution is responsible for several million premature deaths each year, with some 91% of these deaths coming from ambient air pollution occurring in low and middle income countries. So looking at our measurements, although majority of deaths attributable to air pollution in Egypt are due to natural sources of PM2.5, such as sea spray and desert dust, over 15,000 premature deaths in Egypt in 2018 were due to human activities, mostly from transport and industry and waste, causing PM2.5 exposure, meaning that there is a great opportunity to reduce these deaths through mitigation in these sectors. So that comes to the end of my presentation, and I'll just reiterate those three key messages. The first being that no country is immune from the health impacts of climate change. The second, the COVID-19 pandemic and climate change represent converging crises. And third, aligning the global recovery from COVID-19 with our response to climate change offers us a triple win: improve public health, create a sustainable economy, and protect the environment. Thank you so much for listening, and I look forward to the panel afterwards.
All right. Thank you, Dr. Alice. Thank you. We're in this together for sure. And I would like to quote you for saying the time to act is now. And we'll take this to this will take us to our first panel for tonight on global governance, addressing the health impacts of climate, and how do we build better, healthier, and greener post-pandemic recovery. On this panel, we have Dr. Alice, the Lancet Countdown, Dr. Mawaheb ElAzm, ex-Chief Executive Officer of Egyptian Environmental Affairs Agency in Egypt, and Dr. Maha Adawy, Director of Healthier Population at the World Health Organization for the Eastern Mediterranean Regional Office. And my first question is for you, Dr. Alice. In your opinion, what are the key findings outlined in the Lancet Countdown 2020 report in terms of the indicators for climate change impacts, exposures, and vulnerabilities?
Yeah, absolutely. So I think I touched on a few of these just now, looking at the heat indicators. So our key findings are that heat exposure and exposure to both heat waves and high temperatures daily is increasing around the world, and that is having a series of consequences, both in terms of heat-related mortality and related impact on labour capacity loss. It's quite interesting that the distribution of these is that a lot of the higher income countries are greatly affected by heat-related mortality because they have a greater over 65 population, whereas a lot of the lower and middle income countries are more greatly affected by the effects on labour capacity loss because they have a higher dependence on agricultural sectors, for example. So that's a key finding. In terms of other impacts, we also found that the climate sensitivity for infectious diseases, such as dengue and the transmission of dengue, as well as the transmission of malaria and the transmission of Vibrio bacteria, which cause gastrointestinal and wound infections, as well as severe sepsis, is all increasing. And so for both vectors, for the dengue mosquito and looking around the coast for Vibrio bacteria. Also, we have found that looking at various crops, so the world's key crops, considering maize, wheat, as well as rice and soybean, the crop growth duration time is decreasing for each of these, which means that the crops, if their time is shorter, it means that they mature too quickly and the overall crop yield is expected to be lower. So the crop yield potential is declining globally for each of these and has been declining over the course of 40 years since the 1980s. So they're the key kind of areas that we look at. We look at heat, we look at extreme events. The other one, sorry, I didn't mention, was looking at wildfires. And we've found that considering both the risk, the number of wildfire risk days, and also the actual exposure, looking at satellite imagery of wildfires, both of these are increasing. And so the increase in risk over the last 20 years it's increased in 114 different countries. And looking at the actual exposure to wildfires, that's increased in 128 different countries. I think that's all.
Yes, that's very informative, Dr. Alice. And now this takes me to Dr. Mawaheb ElAzm. And Dr. Mawaheb, in your opinion, how has climate change affected communities in Egypt from perspectives of health, environment, and economic perspectives?
Can you hear me now? Yes. Okay. First, I want to speak about the national strategy for in Egypt for adaptation and mitigation. Actually, you have a national strategy concerned with water resource scarcity, sea level rise, agriculture, crops. So it's going to affect environment. According to this environment, it will affect air pollution and water pollution and biodiversity and the coral reef. Will affect all these areas. In health, the country will be burdened with disease due to climate change. The scarcity, the decrease of water, because water Egypt depend 95% on fresh water from the Nile River, and we have two scenarios for this Nile water: either by evaporation, water will decrease, or by or the other scenario that the water will increase. So we have two levels for adaptation. Either the flood will increase and the high dam is not going to be enough for this water, and we will have floods, so it will affect health from vector-borne disease, waterborne disease, a lot of things. So it's very important to have an adaptation method in Egypt for preventing any health effect. Economic. Climate change could have significant adverse economic impact in Egypt due to its agriculture is highly vulnerable to the climate change. Since they depend on Nile water, susceptible to temperature increase, decreased food production, and associated with high food price, which will increase malnutrition and unemployment. Also, the tourism sector will be affected. So this is the area that are you speaking about.
All right. All right. Thank you, Dr. Mawaheb. And we're very much interested to learn from your experience. Based on your experience, what are the accelerating health issues of impact of climate change mentioned before, and how can climate change adaptation aim to protect human health?
Actually, adaptation, we have a lot of scenario for adaptation, so it will affect health. As I said before, the scarcity of water, that there is not going to be a water supply, so it's going to affect health with waterborne disease, air pollution. There is a lot of diseases affected by air pollution. Increased flexibility in the Egyptian community dealing with the risk of disasters. Because in this, can you make the question again, please?
So, based on your experience and the accelerating health impacts of climate change,
I can't hear.
Can you hear me now?
Yes, now.
All right, super. So, based on your experience and the accelerating health impacts of climate change, how can climate change adaptation aim to protect human health?
Actually, we must speak first about climate change adaptation. We are making three field adaptation: in water resource scarcity, in sea level rise, and agriculture deficiency. In all these, if there is no adaptation plan in Egypt, it's going to affect health. And I said we have for water, we're going to have a waterborne disease, a vector-borne disease, a lot of asthma disease. I think Dr. Sameh speak a lot about all the diseases can cause from airborne or from waterborne. And also the agricultural crop, I said that we are going to have malnutrition due to high price of crops and scarcity of agriculture. Okay.
All right. Thank you so much, Dr. Mawaheb. And now moving on to our third panelist, Dr. Maha Adawy, Director of Healthier Population at the World Health Organization. My question for you is, what are the most prevalent health impacts of climate change, specifically in the Eastern Mediterranean region?
Okay. Well, thank you very much, Angie, for inviting me to the panel. And I want to thank Dr. Sameh Farid, Dr. Lamis, Ragab, and Dr. Lamiaa Mohsen for the very kind invitation, and thank both Dr. Sameh and Dr. Alice for really wonderful presentations and a great summary of the report. It's really wonderful to have this summary at this time of the year. Like you said, it's the 5th anniversary of the Paris Agreement, which we're trying hard, and I was very happy to see that the WHO, and I'm sure it's our headquarters office in Geneva, that has been part of this work that you've been doing with the Lancet. It's clear, of course, from the presentations that environment and health are very tightly linked. Our main problem is that people working in health do not really see this issue, and having had this as a Lancet edition and the Lancet report coming at this time, I think will be one of the most important factors to draw much more attention to the issue of environment. And let me, before I start, to tell you, the Eastern Mediterranean region encompasses mostly countries in Arab states countries, except for Algeria in North Africa, but otherwise North Africa, East Africa, including Djibouti and Somalia. as well as Iran, Pakistan, and Afghanistan. And the reason I want to mention this is that I saw also in the slides that Alice had shown us how the three biggest countries in the region, Pakistan, Egypt, and Iran, have really very bad indicators showing the very negative impact of climate change on health. We have some direct effects and impact, if you want to call it, but it's really direct effects and indirect effects. And the direct ones that we see are the changes that we have seen in many countries like Pakistan, in Yemen, in Somalia, in the recent years with an increase in malaria, in cholera. Yemen had the worst outbreak of cholera in the history of the globe that we know of, that is in the past few years. And this is all due mostly to climate change. We should not forget that our region, this Eastern Mediterranean region, is the region that has the highest number of people who are migrants and refugees. Many internally displaced because of the conflicts that everyone is aware of. I don't even mention it because I think it's something everybody is fully aware that we have a lot of emergencies. On top of COVID, I mean, COVID came to just to put some icing on the cake, if you want to say it in this way. But actually, we do have a lot of crises. We have from civil unrest, from environmental issues, droughts, floods. Some countries have the whole package: sandstorms, droughts, heat waves, and floods, and everything. So communicable diseases or infectious diseases are really a very important issue. Dengue, malaria, chikungunya, all of these are very important issues that we are seeing, and we are seeing a big rise in them. Respiratory illness, we are seeing this, not only asthma, but also respiratory infections due to the sand dust, and especially we are seeing this a lot in the Islamic Republic of Iran. Non-communicable diseases are really, sometimes people do not have the link between climate change, environmental hazards, and non-communicable diseases, which, I mean, some people call it chronic diseases, but mainly we're talking about cardiovascular diseases, respiratory diseases, and renal diseases, and these are highly affected and impacted. And when we measure health, we measure by the first measure we look at, before we look at morbidities, we look at mortality. So now in the region we have almost annually 500,000 people who die due to environmental causes. So this is 1 out of 8 deaths in the region. This is quite high when we look at it in this kind of figures, and we can now, I mean, with a very simple calculation, you can see that environmental changes are impacting health and causing more death than the COVID-19 pandemic, as we're talking about it. So this is an issue that is very important to highlight, and I really want to thank you for highlighting this also at the academic level. And I think we maybe in the further discussions on the actions to be taken later on, we should be more, we don't have to be politically correct, since this is an academic setting, and talk about the bold changes and actions that we really need to do. Thank you so much.
Thank you, Dr. Maha. And since you give us this regional perspective, I want to hear from you more about, in your opinion, how can the WHO MRO drive the regional response of health and climate change, and further engage the health sector in the global climate agenda?
Okay, so this is a very important question, really, because it's not only what WHO can do, it's what we all together can do. And the first thing you said is that how can we engage other sectors? Unfortunately, when we're working on health, we tend to only engage with the health sector. WHO recently, in its general program of work, number 13, which is like 3 years old now, has finally realized what they've been, so now they put on paper what they have been preaching. We have always been saying that the health impact on health does not come from within the health sector only. In the health sector, actually, it's illness and it's not health. When you're providing healthcare services, when you are dealing with illness. However, if you want to achieve health and well-being, which is the definition of health, you really have to involve all other sectors. And that's why in our general program of work, we have this pillar, a pillar of healthier population. So we're talking about universal health coverage, we're talking about responding to emergencies, but we're also talking about a pillar where we are focusing on issues outside the health sector. In the Eastern Mediterranean region, and we focus on this region and what we are doing now, we have commissioned, led by Sir Michael Marmot, a commission on the determinants of health, which it's a commission which includes a number of commissioners from the region, mostly from the region, who are working on the different determinants of health with a focus on environment and other social determinants. There's, the environmental, social, commercial, and economic determinants, but we are focusing on the environmental determinants and the impact of the emergencies of the region to give it the regional flavor. This report was supposed to come out in October, however, and it started actually in November of 2019, so it's almost a year ago. But with the pandemic in sight when it came, we decided to extend the duration of the commission to end in March and to have special focus also on the inequities created by the pandemic, the COVID-19 pandemic. So this is one action that is taking. Another approach that we're doing is we are looking at the whole of government approach. We are trying to work closely with the ministries of health to go beyond the Ministry of Health. So they should extend to work with Ministry of Economics, for example. I mean, both Professor Farid and Dr. Alice, they spoke very nicely about the economic impacts and the link. And you have seen it also, all of us. We have seen what happened with the policies that were set in place, with the lockdown policies or curfew policies, whatever happened, depending on the country. But all of these policies have had impacted both the economy and health of people. So these are two sides of the same coin. So we need to work with ministries of economics. We need to work with ministries of planning. We need to work with the education. We want to look at the gender issues as well, and all the inequities that are there in place. And because environmental, I mean, with the heat waves, with the water issues in place, we know that gender gaps also increase. I think you are aware that in many places around the world, women have to go to walk for long distances to get the water. This happens also in our region. It happens in Somalia, it happens in Djibouti, it's happening in Yemen now, and some areas of Afghanistan and Pakistan. So we have to look at these issues in a very comprehensive way, and we have to bring this whole of government approach. Another approach that we're doing actually is working on health and peace. And you would wonder what is the relation here of the health and peace, but peace, we think, is also a factor that relates to environment. I think, Alice, you mentioned that droughts, and Dr. Mawaheb also mentioned very nicely that the issue of water and the availability of water around, this is a crisis for a country like Egypt. Egypt is not the only country that is being affected in our region. We have Sudan, we have other countries around the region that will have a water crisis or are expected to have a water crisis in the near future. So how can we tackle this? The whole of government approach and looking at the determinants of health and making sure that the Ministry of Health can extend its collaboration, and I'm not going to say cooperation, no, I want a collaboration where everybody has the same goal to work for together and move the agenda forward for health and well-being together. We have to continue to say health and well-being and not just health or health services and so on. Thank you.
All right. Thank you, Dr. Maha. We should really work on this together. And finally, my final question to the panel, building on working together, in everyone's opinion on the panel, how can we align the COVID-19 recovery with our response to climate change? And I would like to start with Dr. Mawaheb. If you can tell us your input on how do you think we can align all together, work together for the COVID-19 recovery in response to climate change?
It's not of COVID-19. We in the environment, we are not dealing with COVID-19 actually. But I can tell you what the government and the civil society can do in the field of climate change. Okay?
Sure, go ahead.
Actually, what the government have done in the field of climate change, we developed a national strategy for adaptation and mitigation. All of us know that in mitigation, especially, Egypt is one of the non-A country. We are not forced to decrease our emission because what we use in Egypt is 0.5% of green gas emission in the world, according to the UNFCCC and according to Kyoto Protocol. But we participate in, we increase the flexibility of the Egyptian community in dealing with the risk and disasters caused by climate change and its impact on different sectors, and enhancing the capacity to absorb and contain the climate-related risk and disaster. To achieve these two goals, we should integrate an adaptation plan in different sectors. And I think we speak about the adaptation plan here in Egypt, in the water resource, sea level rise, and agriculture. And enhance community participation in all levels, like governmental and non-governmental and civil society. And also monitoring and assessment, all the follow-up. For air pollution, for example, Egypt have more than 80 continuous monitoring stations in all over Egypt for air pollution. And with this air pollution, we have all the gases, CO2 and nitrogen oxide, particulate less than 2.5 micron and more and less than 10 micron. All these will affect the health of the respiratory system, and due to high temperature, it's going to affect human beings. In the role of civil society, we should work on, or what we are working with civil society, raise the awareness of social vulnerability, issue and challenge, deliver service to meet social needs such as health, food and security, capacity builder by providing education. Environmental issue in Egypt generally and related to low terms of public attention. The problem is the environmental have a very low attention with the public attention. The public attention are concerned with socio-economic like education and health and unemployment, not with environment. We have this problem with the public attention. For COVID-19, I think that climate change with the increase of temperature, with the sea level rise, and the increase of temperature is going to affect the COVID-19. Because the COVID-19 is increasing during high temperature, and in Egypt we'll have 1 or 2 degree high temperature. That's it. Thank you.
All right, and the same question, Dr. Alice. In your opinion, how can we align the COVID-19 recovery with our response to climate change?
So I think the first thing that we need to do is ensure kind of a trans-sectoral response and trans-sectoral approach when we are developing our plans. So we need the ministries of environment talking to the ministries of finance and the other areas involved, and of course public health as well, the ministries of health. Every measure that is implemented, and whether that's at the national level or at the state level or the city level, they need to consider their current commitments to the Paris agreements, their nationally determined contributions, their state level or city level agreements to that. And with that could be a range of different possibilities. So these economic stimulus packages, what they're going to do is they're going to put money into different sectors, into different industries, into different projects that will provide growth and jobs and opportunities. And those need to be in projects that push forward our response to climate change and our commitments towards keeping warming to below 1.5 degrees. So such as renewable energy, looking at solar, wind, looking at other forms of renewables, looking at strengthening energy systems and their grids and making sure they're more reliable. And there's so much we could do more there. And then looking at areas such as transport, looking at increasing our cycling infrastructure. We know in many different cities that they have done this during the pandemics. And then also importantly, it's about strengthening our health systems as well. And we're doing this in response to the pandemic. And this will also help us with our response to future health shocks related to climate change.
All right. Dr. Maha, again, the same question. How do you think we can align the COVID-19 recovery in response to climate change?
Okay, you can actually align and you can also work in parallel. So you don't have to do either or, but alignment, I think one of the things that you do that if you work on establishing governance, policy, leadership responsibilities to protect health from changes that happen, whether it's a climate change or it's a pandemic, then that's fine. When you work on ensuring that the health systems are resilient and that they're looking at the different impacts of environment on health and also look at issues related to COVID, this is some sort of alignment. When you make sure that the sectors work together, make sure that you bring all the different sectors together, this is an alignment. We have seen how and I think this was at the beginning of the pandemic with the lockdowns, we have seen some positive effects of COVID on the environment. And Alice, correct me if I'm wrong, but we have seen when people were distancing, when there were no flights, when there was this effects that we said are positive effects. However, we know that these are not sustainable because things will probably get back to normal or even worse because people try to catch up in with the economic issues. So what you need to have in place is that policies and structures that protect people, and you need to have the structures that can actually put the right frameworks in place. So, and we have a lot of those. So the issue is to translate this policy based on the evidence. And I think the report from the Lancet and other frameworks that are available now, whether it's at the WHO headquarters level with the World Health Assembly or with our own regional committee in the Eastern Mediterranean region, we have some works and we have some evidence to show us how we can improve the health and well-being of people, looking at different frameworks and impacts and look at the indicators related to the environment. You need to bring this together. But I think you don't need to always align. I think this is the message that I'm trying to do. What you want to do, I think in the report, it says improve public health. It says have a sustainable economy. You need to protect the environment. You need to protect the health of people. These things together actually and looking and working on combating COVID-19, which inshallah we should have good effects after the vaccine is in place. I hope. I'm just keeping my fingers crossed and hoping for this to happen. But we really need to look at the different crises together, try to converge our work and have some sort of strategies to look at them as a package in order to improve human health and well-being. That's it.
Thank you so much. Thank you so much, Dr. Alice, Dr. Mawaheb, and Dr. Maha. It's true. In addition to having structures and policies to protect the people, we also need to look on how we're going to shape the future medical professionals in regards to their education. And this takes me to our second panel for today on the role of healthcare professionals, educators, and students in tackling health and climate change through curricular transformations. On this panel, we have Professor Dr. Lamis Ragab, Newgiza University Vice President for Life and Health Sciences, Dr. Lamiaa Mohsen, Newgiza University Dean of School of Medicine, and Ms. Omnia ElAzm, Liaison Officer for Public Health Issues at the International Federation of Medical Students Association. And starting off today with Dr. Lamiaa Mohsen, our question for you is, how can the health community contribute to the collective efforts towards shaping a post-pandemic recovery that places public health and the health of the environment at the center?
First of all, I would like to express our pleasure at School of Medicine, Newgiza University, to be the platform to launch this very distinguished Lancet Countdown Report. And it's really, we're pleased to be, as Egyptians, I mean, Egypt is launching that report through the platform of a university, which really augments our belief as being part of the community, not only a School of Medicine as an educational organization. No, it has an objective part and role in the community with all its problems, whether health, environment. Of course, the world is experiencing an unprecedented change in the global climate system. And this challenge uncovered, together with the COVID-19, uncovered some of the greatest fragilities and strengths in our health system, as well as the health systems globally. Unfortunately, the most vulnerable are the least able to navigate and survive the pandemic, and our healthcare system, as a part of the global healthcare system, experiences a lot of challenges in making PPEs available, enough testing, enough ICU beds for most of the ill. Of course, our community, like other communities, are having significant shifts, and at all levels of the government, it is known that we need to respond very, very quickly and immediately, yet that the recovery process will take years. But in order to just directly answer your question, we need to add a lot of strength to the prevention of the climate-sensitive health risks. And by this, I mean, like the heat waves, we need to maybe think about policies to shift hours of work from the morning to the night, the issues of air pollution impacting on bronchial asthma and chest diseases. Maybe we need to focus more as a country and globally on these issues. We need also to build capacities to overcome the increasing risk of climate change. And by building capacities, I mean national capacities at the government level, at the policy level, at the level of NGOs, together with stakeholders, in addition to the multi-sectoral approach to which Professor Farid and Dr. Maha Adawy pointed to, that it is very important to augment challenges, to augment work between the different sectors to overcome the challenges in the food and water and sanitation, and mainly by building on the existing strengths. Also, providing healthcare should be integrated into other public health functions and capacities. So we have to be, more alert, not only on health and health system as it looks so vertical, not only on the curative component, but again, on the preventive sector and the preventive component, which carries it deserves a deep look on the different determinants of health, on the sanitation, on the water supply, on poverty, on different things. Again, we need to think very well how we are going to build resilience of the healthcare providers by reviewing the current processes that are going on and strengthens the weaknesses in the links that are present. For example, of course, we need to think on supply chain resilience. How will we supply the PPEs, the ventilators, the other equipment? Again, what are we going to do about the single-use spaces? We do have hospitals, but some hospitals are specialized. We need to think in a more pragmatic way. These single-use spaces should be, again, like education is being transferred to hybrid education, these spaces need to hybrid, so they can be acclimatized to different users to meet this crisis. Again, the healthcare infrastructure has to be safe for the workers, safe for the patients, for the providers in terms of space, in terms of, where they can work safely inside the healthcare facilities. Again, resilience has to be built within the pharmaceutical industry, and it comes from the way these companies are collaborating with the different research institutes and governments and NGOs in order to search for new treatments and new vaccines. Strengthening these bonds between different stakeholders is very, very important in order to be well prepared to confront not only the COVID-19, not only the impact or the what's going on between COVID-19, the relation between COVID-19 and climate change, but also all forecasted infections and outbreak and crises that we all know are coming definitely in the future, either as a consequence to the climate change or to whatever unknown changes we can experience. Again, and this is to add moreover on Dr. Maha Adawy, it is the prioritization of the health and well-being of the community. It's not only the health and well-being of the workforce, of the workplace, and strengthen the public health system, the public health, creating safe transport, improving the air quality, all this should be done. And of course, among the different sectors, it is universities and medical schools in particular who need to walk the talk, not only by adding climate change and emerging infections to their curricula, no, not only by that, but really by objectively allowing students and creating platforms through which these students can help by advocacy, by awareness, by really being innovative and working with NGOs and maybe with the government to create or to think in the response and how to increase the resilience to these very two important issues, the climate change and the COVID-19 or any further outbreak to come. Thank you.
Thank you, Dr. Lamiaa. And now we move to our Dr. Lamis Ragab. In your opinion, Dr. Lamis, is there a place for climate change in medical curricula? And how can healthcare professionals and educators build the capacity of the current and future health workforce in the advocacy of health and climate change?
Thank you very much, Inji, and thank you very much to the medical school for this very nice event. And thank you to the speakers who were very elegantly and nicely framed the fact that the climate change is the greatest global health threat of the 21st century. It's expected to seriously compromise the public health assets and infrastructure. It's beyond adaptation, devastating to the majority of ecosystems. These are the facts that we knew and we emphasized this evening. I just want to stress 2 points. That the effects of poor air quality, food quality, poor housing will disproportionately affect or harm the health of the disadvantaged populations more than the advantaged ones. And then besides the physical diseases, the cardiovascular, the respiratory, and the bacterial diseases, the vector-borne, and mentioned by our distinguished speakers, I want to stress that the mental health issues are also very important in this area. And also that the economic collapse, it is said that the economic collapse will have an impact greater than the 2 world wars and the Great Depression combined. So it's very frightening, but as you said, Angie, we'll have to face it together. What do we need in our medical education? Doctors, nurses, and the broader profession, they have a central role in the health system adaptation and mitigation, in understanding and maximizing the health benefits of any intervention, and in communicating the need for an accelerated response. But actually, our future doctors are not taught enough about the biggest health threat that they will face in their career. And so we need to transmit this to our curriculum development. How our curricula are done? Well, the very good definition of curriculum development I like is that the curriculum is a formal educational plan based on the results of a needs assessment, and including goals and objectives that are developed to meet these needs, and teaching methods to implement this plan, plus evaluation of the plan with feedback for the issue of continued improvement of this educational process. What more do we need as evidence than the results of a global survey done by the International Federation of Medical Student Associations in 112 countries, with the result that the climate change is taught only in 15% of medical schools. So, as I said, our future doctors, they are not taught about the most important global health problem that they will face in their careers. And actually, medical students have become increasingly more interested and active in global health issues, but the medical schools have been slow to respond. The schools can take several steps to meet the growing global health interest of medical students, which will make them better physicians and strengthen our medical system. And this activity, for example, is what a medical school can do. And our medical school is really commended for doing this, and all medical students will have to reflect on this event, as Dr. Lamiaa told me. Going back to the curriculum, when you construct a curriculum, it's done by a curriculum development team. And the individual beliefs of this team on teaching and learning and the content matter will have an influence on the curriculum. And the cast of characters sharing in the development of this curriculum, they include representatives of what we call the 4 common places: the teachers, the learners, the subject matter, and the milieu. And ideally, this team or this committee should include psychologists, sociologists, social workers, employers, parent groups. And in the literature of medical education, no curriculum is fortunate enough to find full representation of all 4 common places on its development team. And therefore, the team should ideally include experts on global health hazards, and the subject of climate change should be included in the national academic reference standards. Because actually the main goal of medical education is the improved health of all people. So we should prepare our medical students as they enter the profession. It's imperative that they graduate with an understanding of the implication of climate change and planetary health on the physical and mental well-being of their patients. Because till now, the schools are not meeting the needs of our students preparing for work in our global society. So to sum up, the climate change should be integrated into the education for 3 reasons: to prepare the students for clinical practice in a climate changing world. This is number 1. To promote public health and eco-health literacy. And finally, to deepen the existing learning and strengthen the graduate attributes. And because of the effects on human health, it's of fundamental relevance for their future. It has to have the objectives, the teaching methods, and the assessment tasks to outline this climate change module into the medical curricula, because there are always emphasized and de-emphasized objectives in the curricula, what we call the null curriculum. So giving the impression to the students that it is not important, but if they have the very clear learning objectives, the good teaching methods, and the assessment tasks, I think it will be respected by the students. So they should have measurable learning behaviors for the students regarding this module. And also this must be extended into the second mission of the university, which is research. So because in academia, the publication of original research on health and climate change, it has increased by a figure of 8 from 2007 till 2019. So we should encourage also the inclusion of the climate change and its relation to health into our research plans and research strategies.
All right, thank you, Dr. Lamis. And building on what you have said on preparing students for the future and to face the challenges that we're facing both on health challenges and climate change, and also building on what Dr. Lamiaa said on the importance for education institutions to serve the community, I'd then like to move to Ms. Omnia and hear from her about what are the efforts led by medical students globally in the research and advocacy interventions for health and climate change.
Perfect. Thank you so much, and thank you for inviting me to this amazing event. I am learning so much from our previous interventions, and I would like to bring in more the perspective of what we as medical students, we are doing for health, environment, and climate change. So as a medical student, I believe that my role does not just lie towards my patient, but it also lies towards my community. And at the same time, I would be the first line responder and at the front line of the crippling health impacts of climate change that my patients will be suffering from. I will be the first person to see my patients suffering from acute injuries due to extreme weather events, or asthma due to air pollution, or heat stress due to increasing temperatures, as Dr. Alice has highlighted, and malnutrition due to crop failures. In addition, right now I'm doing my final year in Ain Shams University, and working during the hospital during the pandemic, it really showed me how our healthcare systems are really fragile and vulnerable, and they were unable to withstand the threats that are posed by COVID-19, which means that they are also unprepared to face the current pandemic as well as future crises as the climate crisis. But as a young health advocate in IFMC, an organization that represents more than 1.3 million medical students right now from 134 countries, I was inspired. I really had the wonderful opportunity to lead our advocacy efforts when it comes to climate change and health. I saw also the global and the local efforts that are led by medical students around the world, advocating for the health impacts of climate change, but also maximizing the health benefits to climate solutions. I realized the opportunities that we have as the future health workforce to drive action on climate change. And I'm so excited now to share with you how we did that. My journey in climate change and health started in COP24 in the UN Climate Change Conference that took place in Poland, and that was 2 years ago. I was one of the IFMSA delegates attending this conference, and in the next year in Madrid, I led the IFMSA delegate going to the same conference. We worked really closely with one of the biggest alliances called the Global Climate and Health Alliance, as well as with the World Health Organization, trying to lobby for the integration of health at the heart of the climate negotiations among key stakeholders such as parties, member states, NGOs, and civil society organizations. However, every time I come from such conferences, I realize that many medical students, like myself, and young healthcare professionals are still unaware of climate change and its interlinkages with health. So, to create an evidence-based sense of urgency to drive the redesign of medical curriculum to integrate climate change and health, we did a global survey. And I'm so happy that Dr. Lamis mentioned it, and I'm very excited to elaborate a bit on it. So we conducted a global survey. It started in March 2019. We asked 112 countries. We asked medical students there 3 questions. How many medical schools do you have? How many medical schools have a mention of climate change in the curriculum? And how was it mentioned? And we were able to prove that only 15% of all the 2,817 medical schools had a mention of climate change. What was even more interesting is that mention was inconsistent. So less than 14% of them had 1 lecture every year, and another 14% had it only as a non-mandatory lecture. So even if climate change exists in the medical curriculum, it's still very inconsistent and weak. And at the same time, it shows that medical students like myself are not sufficiently trained to recognize the interdependence between health, environment, and climate change. And this also means that it certainly would not be possible to shape a green and a healthy recovery without having the involvement of the future health workforce and their efforts in its integration. In addition, we conducted another survey in March 2020, and we wanted to focus a bit more on air pollution. The reason why, because we believe that air pollution, as WHO mentioned and proved, kills more than 7 million people per year. So in collaboration with WHO Air Pollution Department, we did the same survey, but we focused specifically on air pollution. And we discovered that even a less percentage of medical schools had it mentioned. This time we had 92 countries participate, and we only saw 10% had that mentioned. So this means that medical students are not aware of the leading killer of 7 million people globally every year. But this survey gave us an opportunity to collaborate more formally with WHO. Together with them, we created a map that had all the countries that we asked. And in this map, you can see the situation in each country. In addition, they invited us to join the expert working group to develop a training manual for healthcare professionals and medical students to teach them how to apply their knowledge on air pollution, both in their clinical practice and when it comes to research. In addition, to address such a huge gap between climate change and the curriculum, we did our own capacity building initiatives. So far, we held over 30 webinars with climate and health experts from around the world, attended by over 10,000 medical students. And at the same time, this inspired us to create 2 manuals. One was with WHO, a training manual on climate and health, and the second was a 101 manual for medical students to learn how to design activities on climate change and health, both in their own faculties, but also within their own communities. I also cannot end without mentioning the imperative link between food systems and climate change. And we had another great opportunity to collaborate with an organization called EIT, the European Institute of Technology, and top 6 European universities. Together with them, we designed the first ever online course for medical students, teaching nutrition for health and sustainability. And so far, we have over 105 registrations, and the course is starting this month. And we're planning to present the findings of this course in the next year during the United Nations Food Systems Summit. And finally, I cannot end my presentation without sharing a few examples of what medical students are doing on a local level in their own countries. One of my favorite examples is from a group of medical students in Australia. What they did is that they did a competition for all the students to think about innovative ways in order to create an environment-friendly and sustainable hospital and healthcare facilities. And this competition had funding, so the students that came up with the best and the most innovative way to make their hospital have a less carbon footprint, they were allocated funds to actually implement that. While in Germany during COVID-19, medical students had the opportunity to create a Planetary Health Academy, which is a series of online lectures dedicated for climate change and health. It was really well received, and it was attended by over 500 attendees. And at the same time, it was also certified, and they received credits for it. And finally, they are now setting it in East Africa. So one last thing, I will leave you with a small question. So how can you work collectively with us, the medical students and the future health workforce, to shape a greener, healthier, bluer, and most importantly, a resilient post-pandemic recovery that places our health, but also the health of the environment at the center?
All right. Thank you so much, Omnia. Your spirit and the youth spirit is very apparent in the way you speak, and it's very inspiring to have young people on board with us. And now we have a question for Dr. Lamis Ragab on what role can health professionals, universities, and facilities play in the adaptation and reduction of the carbon footprint of health systems in Egypt.
I'll go again and stress that education comes first. So if you educate the future doctors, and by the way, if they get educated, they will educate others. So it's the principle of TOTs, or train the trainers, and they will expand this experience to their families, their neighbors, their friends, their classmates, and everything. And not only the future students, but also the future nurses, the whole group of the healthcare professionals. So I believe they have to be taught together as a group. So education comes first. This is the first thing. And then, as Omnia nicely elaborated, through online courses, through workshops, through even, like Dr. Maha Adawy said, that we have to talk to everybody. If you go to the Ministry of Communication and have TV shows or series or something like that, talking about climate change and the impact on health, this will be great. But it has to be a cooperative work between all the stakeholders, if you want to call them like that.
All right, Omnia, same question to you. As a student, how do you think educational institutions can work on adaptation to lower the carbon footprint?
Yes, thank you for the question. And one thing I will also want to emphasize, as Dr. Lamis mentioned, which is education, because it is, I believe it's a key facilitator across all healthcare sectors. But also it's also very challenging to change curriculum. This is also a challenge. But at the same time, by understanding how a healthcare sector is contributing and what are the carbon footprint of the healthcare sector, this has to be the first thing that we need to do, to raise the awareness of the students and of the different stakeholders of how a healthcare sector contributes to the greenhouse gas emissions and contributes to the climate crisis. But at the same time, we realize with COVID-19 that we need to build more resilient healthcare systems, because we saw the vulnerabilities of that. So as we rebuild new healthcare facilities, we need to do it in the right and the sustainable way. And I have recently worked with an organization called Build Health International. What they do is that they go to areas that are facing a lot of extreme weather events due to climate change, like small state islands and so on. And what they do is that whenever there is a crisis, and for example in Haiti, they had their hospitals completely destroyed. What they did is that, based on donations, they went to these small state islands and they rebuilt these hospitals and they installed solar panels in these facilities. So at the same time, they are reducing the carbon footprint of the healthcare sector, but simultaneously they are creating resilient facilities that can help. And another interesting thing is that the World Health Organization just released a manual on how to build environment-friendly and sustainable facilities. But at the same time, if we have access to these kind of manuals and to these activities, this will help us put the pressure and facilitate ways. And this is my final thing, would be the importance of also having meaningful student engagement in these discussions. So it's not just up to healthcare facilities or educational institutions or governments to do that. We need to work collaboratively together. And we as young people, we can bring the energy, the innovation, and the urgency, because these are the future facilities where we're going to work. But at the same time, we cannot do it on our own. And we need the collaboration from the educational institutions to support our effort in a collective way.
True. Your energy makes all the difference. Dr. Lamiaa, the question is for you. In regards to next action steps, what do you think needs to be taken in tackling the climate change and health issues we're facing?
At Newgiza University or in general? Well, I think at Newgiza University, we actually started it. There will be a task or an assignment for all students, the 5-year students, year 1 through 5, and they will reflect on that webinar today, on the report particularly, and it will be part of their formative assessment. And as well, we expect from them in this task to reflect on the way forward. We are going to NGU Medical Association, which is part of the IFMSA, will be definitely creating some awareness and collaborating with the IFMSA to be part of the awareness campaigns going on and the advocacy towards the climate change. We had an initiative for the Go Green, and I hope, Inji, I'm not sure we did anything remarkable in it, but at least the initiative is there and it should be pushed forward. This is for us. Furthermore, though we have climate change issues in our curriculum, yet we think it's not yet enough. We think that further to that report, we should be thinking more how to add it more, mainly by something practical, not by lectures, but how to really have it deep and sunk in connection to our vision as healthcare professionals for us and for the students as well. I think nationally it is the same. I think Newgiza would act as an advocate to all other medical schools to carry the experience to them and really to start creating this dialogue maybe with other medical schools in Egypt and with other stakeholders, because we have to adopt the multi-sectoral approach. So it's not only medical schools, we have to think how we will approach the Ministry of Health, how we will approach NGOs over health. I think we have a lot to do. And I think this is not only my opinion, it is again the opinion of the senior management team at the university. The vice president and the president, I think, are totally on board, totally willing to adopt this thought and idea. Thank you.
Yes, thank you, Dr. Lamiaa, and I'm sure the reflection and the initiative taken by School of Medicine on this to involve students in the process of thinking of next steps is very empowering as well to everyone. And going back to Omnia, if you as well can comment on what Dr. Lamiaa has mentioned as action steps. In your opinion, what are the concrete actions through which the medical and broader health community can do to shape a healthy and resilient recovery as we build back better?
Yes, I think this really reminds me of something Dr. Maha mentioned, which was how we as a health sector, we are still not aware of the issue. So one of the things that we really try to focus on to try to mobilize all the different professions within the health sector, if we're talking about students, but from all multiple disciplines, as well as young healthcare professionals and doctors, and the broader health community. And this is important. We really need to build, as education is equally important as advocacy and awareness, but we need to do both. And at the same time, another project that we did in IFMSA following up on the survey that we conducted and we finalized last year is that we saw that now we have the reason why there is an alarming gap, and we want to even push it a bit more and encourage universities and hospitals and facilities and institutions to actually integrate climate change in the curriculum. So what we did is that we created a framework for climate change in the medical education. And this framework was formulated by a group of 7 medical students from 7 different countries and 5 regions. And we did 2 consultations, one in Rwanda and one in Taiwan before COVID. And based on that, we wanted to create a framework with learning objectives and simple introductions to each topic, so that what topics that are related to climate change. So for example, if I'm learning about cardiovascular diseases, I would know that now because of the heat stress, this is also increasing cardiovascular diseases due to climate change. So we set a couple of niche topics that can be easily integrated within the curriculum so that we can help more universities do that kind of integration. And this is really what I see as effective when it comes to a bottoms-up approach. Another important example for engaging the health sector is an event like this, bringing in global perspectives and putting it in a regional and a national context and reflecting on the challenges that we face, because again, the global issues and challenges can feel a bit far away from us. So if you try to bring all these findings, for example, from the report closer to home, closer to what we are experiencing, this will trigger the awareness of us as students, but also all the community itself to care about this topic. So we also need that kind of public pressure and that attention. And this really drives me to my final example, which is how the climate movement now is really successful, because you've seen how youth around the world have been mobilizing and striking for climate change. And this movement started from school children that really drove this movement to happen. So we also, as healthcare sector, we have a responsibility for that. We are also the second most trusted profession. So we are really strong messengers when it comes to delivering how climate change is a global health issue. And the first trusted profession is nurses. So as a healthcare community, we have the role to really push for that.
All right. Thank you, Omnia. Dr. Lamis, same question for you as well. In your opinion, what are the concrete actions through which the medical and broader health community can do to shape a healthy and resilient recovery as we build back together?
Yeah, do you mean recovery from the COVID? I would like to live and see the day when COVID is out of our lives, really, because it's a nightmare. It's really a nightmare. It affected us. I think I myself, I need psychotherapy after the terrible year we've been through. Unless we have the support of each other, we won't survive. We won't survive this nightmare. As I think Alice said that both the climate change and the COVID are convergent, I think, convergent crises. Both were inevitable. The climate change crisis is inevitable because when you think of 100 years ago, the US had only 4,000 cars and 10 miles of concrete roads. Look at the US now. When you think of how many cars are developed each day, 4 billion cars per year only in the EU and the US. Think of how many PCs and think of how many mobile phones. This is our doing. This is the doing of the people to their planet. And as the COVID forced us to stay at home, Dr. Maha said that the environment was better, it was bluer, greener, and quieter, and I don't want the COVID to continue so that we can have a solution to our climate change catastrophe. But it is a catastrophe and it is an inevitable one. As we said, that it is beyond adaptation, but if we don't work together very fast, through everything we said, through education, through awareness, through the youth perspectives and what they are doing, I don't think we can survive it. And we are talking about our children, our grandchildren. We're not going to see the effects of this. But we have to keep the planet safe for the coming generations. And I think we have to build a great effort from our side in our curricular changes and connect to other people so that together we can effect a change.
Yes, so true.
Angie, I don't think, Angie, your question has a perfect answer. It's a very difficult question, and it doesn't have a perfect answer, or it doesn't have how we call it, Dr. Lamiaa, the model answer. I can't find a model answer to this question. It's too difficult.
It is. We still need the magic you know, to come and take this COVID away. I'm sure everyone would want to go back to our normal lives where we can meet and connect on the different levels we had before. We have a final question for the WHO. In your opinion, what type of climate-related activities does the WHO support for action? Dr. Maha?
Well, this is a good question, and actually it's probably, it's one of those questions like Dr. Lamis was referring to, but let me first share with you a secret. People like Omnia and Omrani are not many around the world, and if we have more of people like her, then it would be nice. She was actually the co-chair of the second Youth Assembly in the Road Safety Conference for the Decade of Action on Road Safety in Stockholm this year. And I actually have a photo with her in person, so I'm very proud to say this. But we need more Omnias around the world. What can WHO do? WHO does a lot of things, but let me be frank with you. Whatever we're doing, we have a lot of frameworks, we do a lot of reports, we do a lot of studies, we generate evidence, we work with countries, we develop strategies and plans and so many nice things. But I want for us to be able to make a change. I mean, I'm still keeping my WHO hat, but we have to be more integrated in responding to the needs of the community. We need to engage community. Let me tell you something. Long time ago, before you guys like you, NG and Omnia and Khadija and so on, who were born, there was something in 1978 called Al-Ma'ata Declaration. And Al-Ma'ata was basically about primary health care. And primary health care, really, it's very simple meaning and approach. Yes, it talked about reducing maternal mortality and better nutrition and so on. And it had two little items at the bottom that nobody looked at. A safe environment and community engagement. I'm afraid that we have neglected the two most important elements of Al-Ma'ata, or of the primary healthcare declaration. And we are repeating ourselves. We are now talking about universal health coverage. We are not still talking, we're talking about sustainable development goals, but still we are picking up the easy battles or the easier battles. We are not, you know, so we come to the other ones, we do the plans, the strategies, and, you know, all of this nice work. But how are we going to really move? So I want to tell you that now WHO is doing two initiatives, at least in the Eastern Mediterranean region. We are trying to engage with young people associations, including with Omnia and her peers and her association. And I'm very happy to know that Newgiza University is part of this. We're also engaging with Scouts, the network of Arab Scouts and different kind of networks of people who can actually reach to the community, deliver the message, understand what is really needed, how people define their own health and well-being, because it's not people like us sitting in nice offices or you know, doing all. Yes, we need all of this. This is the backbone, but the other, you know, it cannot be complete structure of work unless we really respond to the needs of the community and get them to believe in it. You talked about the community of students, of medical students. Still, Omnia being such a wonderful person she is, and with the full understanding that she has of public health, she said, when someone comes to me in the clinic, then with a cardiovascular disease, I will understand the effect of the heat and the heat stroke on the cardiovascular disease. So she still dreams of being in the clinic. So where is the public health here? Where is being more engaged in the community? I think the clinic is perfect, and I know, and I'm sitting with great clinicians here, but who also have a very strong sense of what is public health. And public health is something that we have missed. I think the way that now, I mean, I think Dr. Lamis has a lot of work to do with this, with the changes in curricula, in changes of ways of teaching and so on, that public health has become more of part of engaging the students, but this needs to be strengthened a lot. And WHO can play a role by providing also more evidence, supporting research, supporting different kinds of activities, and not just having the frameworks, because this we have already. When we launch the commission, inshallah, and now because this is also under healthier population, so I probably have the leverage to do this, I would very much like all of you people sitting now around the screen, I should say, not the table, around the screen, to be part of it and to engage. We will have one session, I don't know how it will be by that time, virtual or face-to-face or mask-to-mask, as they say now, but even if we can have a virtual one with young people engaging and understanding more and telling us, okay, you still need to produce more here and you need to do this better and so on. I think it's more engagement that WHO should think of, not only of the stakeholders, like I probably mentioned earlier, the whole of government and the multi-sectoral and so on, but most importantly, the community and the young people who are actually, like Dr. Lamis said, are the future of our countries, you know, our children, our grandchildren, and so on, because we have to leave a better planet for people. And WHO has to give a much higher priority for environmental health. I think I will take this opportunity that with the presentations, and I don't know if Alice will share her presentation with us, and I would like actually to have a similar seminar like this one inside of EMRU and invite all the countries to be part of it, to see, and also invite you young people to participate, and we've already tried with Omnia, so we'll have Omnia and NG and Liaison and the whole Khadija, the whole group that is really working so from your heart and wanting to make a change, to be there to show the people how change can be made. So thank you. I'll stop here.
Thank you so much, Dr. Maha. And let's start with using students at NGU for any focus groups, any questions you need to ask. NGU students have done a lot to serve the community since it has started, and we'd love to be part of any future plans and collaborations with the WHO. And now we have come to the end of our webinar. And does any of the speakers have any further comments that they would like to add? All right, so I think this is the end of it. I'd like to thank all our speakers today, Professor Sameh Farid, Professor Dr. Lamis Ragab, Dr. Lamiaa Mohsen, Dr. Alice McGushin, Dr. Mawaheb Abou ElAzm, Dr. Maha Adawy, and Ms. Omnia Omrani. I'd also like to thank the behind-the-scenes team, and the attendees, the students. I'd like to extend my thanks to Dr. Shadi Ibroshi, Dr. Walid Abdelhamid, and our great IT team that has been helping us tonight, and as well to the students on campus, Khadija Shamraka and Liaison Al-Medani. Thank you so much for today. It's been very, very insightful, and it was a pleasure moderating for you tonight. Thank you so much. Have a great evening.
Thank you, wonderful, Angie, really. Thank you so much.
Thank you
so much. It was great to have you all.
Thank you.
Bye.
Bye.